that being said, today marks exactly 2 years since President Cyril Ramaphosa announced the first COVID-19 nationwide lockdown. Now, the 21-day lockdown came into effect a few days later on the 26th of March 2020. Now, 2 years on, and we are seeing the easing of restrictions such as masks not being required outdoors. But to explore our ever-evolving response to the pandemic, we're now joined by the Innovation and Sequencing Platform Director from the University of KwaZulu-Natal, Professor Túlio de Oliveira. Always a pleasure talking to you, Prof. Thank you so much for your time. Let's speak about, of course, the President's announcement last night. What's your reaction, particularly on the country's response rate, but also seeing, of course, government attempting there to continue easing down on those regulations?
Yeah. Thank you for inviting me, and good morning to all your viewers. Yeah, in general, I thought that was a very good and balanced approach. Yeah, for example, the restrictions are already very low in South Africa, and we decrease a little bit further with masks not being needed outside. Today was quite a pleasure to take children to school and not have to wear a mask between the car and the school. Yeah, and some entertainment come back of the stadiums. Yeah. And especially for me, I do like football a lot, yeah, and also still trying to drive vaccination, yeah, which is going to be very important also for our travel industry now. If people is vaccinated, they don't need a qPCR to come or to leave the country, yeah. So in general, I think that was very balanced, and in general, I think that was much better what recently happened in Europe, that they just dropped all the restriction, and then a new wave with the Omicron BA.2, it's coming back quite fast there.
Yeah, and speaking of, the variant, the Delta variant is what I want to talk about right now, because experts have warned that between the month of April and May, we should be expecting a Delta-driven fifth wave. With the President's announcement last night that you don't have to wear your mask outdoors, there'll be more people allowed, of course, indoors, pending that proof of vaccination certificate, etc., and so many other regulations. Was this the right decision? Pending, of course, obviously the warning that we're hearing also from experts.
Okay, first, I really want to plead to the public to not get carried out about this Delta-cron. This Delta-cron, it's just a few recombinations at low prevalence that's happened across. That was found in Europe and the United States. At the moment, the sublineage that we are more worried is the Omicron BA.2. It's still Omicron. It has dominated the infections in South Africa since end of January, but that doesn't translate in a very large waves so far, and we hope that do not. Yeah. And in general, I think that it's correct. One has to release this restrictions when infections are low, hospitals are empty. Yeah, I think that more than ever, people want to go back to normal life. One thing that I liked from yesterday is that we didn't completely abandon masks. Yeah, masks are also important for other infectious diseases. So we are having big outbreaks of influenza around the world, and also TB. And in addition to that, simple interventions such as ventilation is still very important. Yeah.
Yeah. And Prof, what do you think needs to be done still to ramp up vaccination? That drive still continuing. The President still appealing to South Africans to go out in their numbers to get the jab. But at this point, what strategy do you think government needs to take to encourage more and more people to vaccinate?
I think that the government in South Africa tried from the beginning to get a strategy that vaccine is optional. Yeah, which I believe that's the right strategy. Yeah, but I think that for the public, as we start going to the winter months, would be very wise to get vaccinated or get a booster. So because normally in the winter months, a lot of times we have another wave of coronavirus, but we also have other respiratory viruses. Yeah, and more than ever, we need our country to come back to normal. So I personally feel that's a small price to pay, to get vaccinated, so we can go back to normality.
And speaking of that normality, I suppose that's why there have been calls as well to completely end and scrap the national state of disaster. Where do you stand on that? What are your views, especially from a medical perspective?
So from a medical perspective and the public health, what we normally say that we should really focus on the public health response, and in our case, it's very quick early identification of any new variant and give back all the data that the government need. In relationship to the state of disaster, that's a political resolution, and normally what I found is that scientists are not the best person to really get involved in that kind of political decision. So I normally try not to comment, because this, I think, is more related to political and legislation. Yeah, and I personally do not have much knowledge on that.
All right. Well, I appreciate you speaking to us nonetheless this morning, Professor Túlio de Oliveira from the University of KwaZulu-Natal. Thank you so much for your time this morning.